well, and when they were trying to investigate them, what they found out that there were holes. There were holes within their skull, on the breast, or on the stomach. And the assumptions were that these mummies were actually cauterized. So what cauterization means is that they were actually using some incredibly preliminary instrumentation, like pieces of metals, and they will heat it up to the point where it will get red hot, and then they will chop that tumor out of the body. So you guys can imagine, now think about this for a second. There was no anesthesia at the time, there was nothing to actually deal with the pain, and you can imagine having these people that were suffering from cancer, and then you have this very, very hot metal going into their body and trying to actually take the tumor out. Now, at the time, Egyptians were the best physicians and best scientists. So for them, it worked out. Some of the patients survived. Some of them that, actually survived the pain and the agony of removing the tumor, they were okay. But a lot of them didn't survive. So fast forward from Egyptian time, like 3,000 years ago, back to the Greek philosophers like the Socrates and the Aristotle. They actually came up with the name Carcinize. It's basically what it is in Latin is cancer. And the reason why they called it cancer is because cancer in Latin is simply like a crab. I don't know if you guys have obviously seen crab, where it has an actual body and they have appendages, legs that are coming out of the actual crab. I know we enjoy eating crab a lot of time, but what really the Greek philosophers were saying that this crab very much looks like what we see in the body of these individuals that are suffering from cancer. And that's why they called it cancer, because at the time they didn't really know what cancer was. They knew that it was a swelling, they knew it was a really horrible disease, but they just named it because it looked like a crab. And looking back now, many hundreds of years later, when we look at the cancer under the microscope, it looks just like a crab. I see this every single day, where you have an actual tumor, and then you have appendages that are coming out of it that causes something called metastasis. We'll come back to that in a minute or two. So when the Greek philosophers named this being a cancer and a crab-like disease, for a very long time, cancer was assumed that it is a disease of evil, where there was a bad spirit that was actually coming in the body, and there was something called the melancholia. There were like 4 different fluids within our body, and these were doing some really, really nice renaissance during the Greek, that they were thinking that there is a yellow bile, there's the red bile, and then there the red fluid, and then there's a black fluid. And they thought that cancer is caused because of this black fluid imbalance. If you have too much black fluid, that means you have cancer. And of course, people who actually had the black fluid, they were considered to be evil. So it was a really, really devastating thing for a lot of the patients, because not only they were sick, but they were also looked down upon as being possessed by these, evil spirits. And a lot of times they were kept away from everybody. They were kind of put away in islands, like some horror stories that you see in the movies. So it wasn't until, I would say, another 100 or 200 years later, where the microscope came about, where you can look at under the microscope and you can see things much bigger. So when the microscope was developed, during this time now, scientists realized when they took the cancer and they looked at it under the microscope, and they said, wait a minute, this isn't something that is coming from the outside. It isn't an evil spirit. It is something that it is within our own body. It is actually something that comes out of our own body. It took a long time, because as you can imagine, to argue with the Aristotle or Socrates or the Greek philosophers, it was not an easy task. So a lot of people wouldn't believe that. They would say, oh, you're completely nonsense, this is not true, cancer is an evil spirit, for a very long time. I would say again, fast forward another couple of hundred years, in the 1800s, when a very, very prominent surgeon at Johns Hopkins University, when he was actually looking at the fact that the cancer is coming from within our own body. So he started digging He started digging, looking for that black fluid that everybody was talking, that imbalance of the black fluid. So he basically did like almost 200 different body. He basically trying to cut every single vein on the autopsy, every single muscle, looking for that black fluid. And he couldn't find it. So basically, he wrote the best anatomy book that we still use in our medical schools. But he came with the assumption that there is no evil spirit, there is no black fluid, and then of course with the help of the microscope now we know that cancer comes from our own body. So this was a very, very revolutionary thought, but there was a bit of a problem there. And the problem was that now that you think that the cancer is from your own body, they thought, okay, well, if you can actually take that cancer out of the body, the person should live, right? The person should be perfectly fine, because if that's where the disease is coming from, so why don't we do that? So a very prominent surgeon by name William Halsted at Johns Hopkins University, where I did my fellowship, he started doing surgery on breast cancer patients. So he started actually identifying a little tiny tumor in the breast. And he took that tumor out, and then unfortunately, the patient died after a year or 2 years. He said, wait a minute, that doesn't make any sense, because if tumor is coming from your own body, and if I'm taking it out, why is it that the patient still died? They were confused, they didn't know well, so they started taking more of the tumor out. So they started taking bigger chunk of the, the body muscles out. They took the tumor out, but they also went around and they took another 10 centimeter out. And some patients survived, but some patients didn't survive. So they were like, well, there's something wrong. Let's take more body out. So they started basically doing something that was known for the longest time as radical mastectomy. It was a very, very barbaric thing, because what the physicians were doing at the time, this was up to like maybe 50 years ago, 40 years ago, what they were doing, if the tumor was located inside of the breast, they will take the tumor out, but also they will take the whole breast out, they will take the muscle in the back and the muscle in the bottom of the shoulder. The patients, in the majority of the time, if they survived the surgery, they were completely incapable of doing the daily function, because now the balance of the body is completely messed up, because you have taken all the important muscles. After about maybe during 1920s, 1930s, people realized that just because you take the tumor out, that's not really the cure or the treatment for the cancer. There has to be something else. And it's a fascinating story about this guy by name Dana Farber. He is actually from Harvard University. He is a pathologist, and he works in the basement of this hospital. And he is looking at all these very young patients that comes in with acute myelogenous leukemia. It's a blood cancer. And every time this patient comes in, when they're admitted in the hospital, after about, let's say, maybe 2 months, 3 months, 90% of these poor kids die. And he's the one that he does a lot of the autopsies. So he opens up the body and he sees that, this is completely insane. We're doctors and we cannot help these poor kids. There has to be a way to help these kids. So, being so ingenious sometimes, not only, I would say, ingenious, but serendipity. It's like accidents that really helps. So in 1940s, during the World War, the Germans were using the mustard gas. And what happened was that the use of the mustard gas, when the soldiers came back to the United States, they realized that there was a lot of cells that were dying in response to the use of the mustard gas. So the Dr. Farber from the Harvard University said, you know what? Maybe I can go ahead and treat these patients with this toxic chemical that is mustard gas, and hopefully that will help some of these patients from dying. And of course, when he suggested this to the director of the hospital said, oh, you're nuts. I mean, how am I going to convince the parents that, we're going to put toxic inside of your child's body and trying to save them? So they were looked completely he was looked like they ridiculed him basically. They said, go back to your basement, do your pathology and do your anatomy work and forget about worrying about the patients. Once again, he's doing all these autopsies on these young children. About a year later, there was a set of parents came to the hospital and admitted twin boys. One was admitted with leukemia, and the other one was admitted with simple cold or something called a flu disease. So the one that was having the cold and the flu was actually released, but the one that was suffering from the leukemia was kept. And as he was basically going home one day and asked the parents of this child, what is wrong with your child? And then basically the parents said, well, unfortunately, he has leukemia. And the doctors have told him that he is only going to live for 2 months. So Dr. Farber cornered these parents and said, look, I have this potential treatment that is not allowed within the hospital because the director does not allow me to do this. But will you let me try this on your kid? Well, chances are that, he may not make it. But if you think that he's going to die in 2 months anyways, why not try it for the rest of the, society? This is a really useful thing to do. And interestingly enough, the parents of these 2 kids were actually scientists, and they said, you know what, we'll do it. So instead of going to the 6th floor where the child was actually being treated, they brought the child at night to the basement where Dr. Farber was actually treating him with this master toxic gas. 1 month passed by, 2 months went by, 3 months went by, the kids are still okay. 4 months, and then 5 months, and then they said, oops, there's something going on here. We got to actually go ahead and bring in the director of the hospital. So Dr. Farber went to the director and said, hey, I want you to come and see something because this is real evident. He said, I have this child that was admitted like almost 6 months ago. I've been treating him with this toxic that now is called aminopterin. It's a basically leukemia targeted type of, it's a master gas, but it's weakened now that you can put it in the bloodstream and it will fight cancer. So initially the director was very upset and he was trying to fire him, but then he said, look, come at least look at the child. They look at the child looked like a perfectly healthy person. And they're looking at his blood count, it's almost come to a normal. There is no accumulation of all these leukemic cells anymore. So the director had no choice to say, well, congratulations, that's a fantastic idea. Why don't we treat all our patients with this aminopterin or with this master gas? This was the beginning of the chemotherapy. Now, the reason why a lot of the patients died from the surgery, if you remember, no matter how much of the body they took, it was because the tiny little microscopic cancer cells that escaped from the tumor, they couldn't find it. No matter how much of the body you took out, those tiny little pieces was in the bloodstream and they were floating around. Now that you treat it with this chemotherapy, it can actually help the patient. So then, of course, fast forward again, now we're looking at the potentially treatment of radiation. And in this day and age where I'm working right now, we're dealing with some fantastic new technology called genomics. And the reason why genomics are so incredibly important, because every individual that has cancer, they are very different from one another. I tell you something that is going to completely blow your mind away is that if I take 5 people from this, anywhere from outside, for example, God forbid they have cancer, same exact cancer, same breast cancer, same lung cancer, every single one of these individuals have different tumor. And if I take the tumor, and if I actually dissect the tumor and look at inside of the tumor, every tumor has its own characteristic, its own zip code, its own property. And for that reason, it has been incredibly difficult to treat cancer. Because I'm sure most of you are wondering still, 2,000, 3,000 years, still we are not really curing cancer. The number one reason is because it's a very heterogeneous, it's a very complicated disease. Now the question is, now that we know that it comes from our own body, that it is really very, very difficult disease, what causes it? What really causes cancer, right? I'm sure you guys are wondering, does anybody want to take a stab at what causes cancer? I mean, I'm sorry?
The cells are multiplied by themselves.
Absolutely. I think it's very true. So there are many, many, many different reasons why cancer can take place in the body. But let me give you a few examples. The number one thing that you need to remember about what causes cancer is mutations. If you haven't heard the word mutation, it is something that changes in the DNA. If you don't know what DNA is, it's what we are made of. If you look around yourself, we're different colors, we're different races, we're different shape, we're different hair, we're different skin. Everything that in our body is built, well, we're believer, God gave us the way that we look. But within our body, there's something called DNA. And that DNA is what dictates who you are and what you look like. And unfortunately, every cell in our body contains the DNA, and if there is a mistake, if there is any mistake in that DNA, that is what causes cancer. The question is, what makes that mistake to happen? One of the most important things that causes that mistake in the DNA is smoking. Smoking is the number one reason for lung and head and neck cancer. So the reason why smoking is bad, because smoking has, cigarettes for example, has 1,200 different toxins inside of the tobacco. And when you smoke it, it goes inside of the body, and then it actually changes your DNA. If it changes your DNA, now it changes your cell, and it will eventually turn into a tumor. Of course, it takes a long time, and also, it's not the same for everybody. Some people actually end up with the cancer maybe after 5 years. Some people might actually end up with the cancer after 10 years. And what's most interesting is that some people may not even get cancer. But those are the only few lucky ones. So, smoking is number one cause of cancer. That's already well established. Because it changes the DNA inside of the body. Number two, what else can possibly, yes?
Eating burnt stuff.
Absolutely. Very good, actually. Yes, I'm sorry to say that. But eating things that are, again, if you eat hamburger or steak or fried food every single solitary day, I can guarantee you that that is going to increase the risk of potentially either for the male prostate cancer and for the female the mostly ovarian and breast cancer. Bacon. Bacon is a very good point. Not only it is processed food, but it is also very high in fat. And I guess the best way to look at this is that smoking is a very, very close correlation with causing of cancer. Now, diet that can include high-fat diet, high-sugar diet, and like taking high-caloric diet, you take a lot of calories, but you're not burning it. There's a deficit. There's too much deficit of high-caloric food, and then what happens is that those things called tiny little, something called free radicals inside of the body, and those tiny free radicals can actually cause mistake in the DNA. And when the mistake happens with the DNA, that's again where the problem takes place, and the cell, grow faster than it's supposed to, and that turns into cancer. I'm sorry? Absolutely, very good. Yeah, you should be my partner. Sun. Sun is another incredibly important that is being associated with a very, very deadly cancer known melanoma. Because if you
I was
actually
gonna tell her,
take
but
too much
I thought
sun,
it's gonna be short, but.
and if you, especially for you guys, it's okay now, but if you have grandsons, grandkids, and people that are younger, if they take a lot of sun, and if they are not really taking care of themselves, they get burned. I can give you an example. If a child before age 15 burns 2 times, he or she is 30% higher risk. 30% higher risk for developing some form of cancer in the future, especially skin cancer. Now, the beautiful part of this is that cancer is horrible, but if you catch it early, it is curable. And that is true of many, many different type of cancer. It can be true of simply skin cancer. If you actually see a little lesion, the best thing is to talk to your kids, your grandkids, let them know that they should go at least once a year to a dermatologist. Just take a base of looking at, they have this tiny little glasses that they put on their eyes, and they look at throughout your body, and they check the molds, they check at all your skin. Make sure that there's nothing funky going on, because if there is, they can take it out right in the office. You don't have to worry about it. But if you let it go, now the cancer goes inside of the tissue and eventually in the blood. And unfortunately, let me tell you an example. If somebody has a cancer that is diagnosed early, there's 100% rate of cure, especially in the case of melanoma. If they're actually identified very, very early, that are known as basal carcinoma. But if you let it go for a couple of years and it goes inside of the blood, 95% of those patients dies within 2 years. Well, it doesn't look like tumors, but it looks like a mold. But the molds in the skin are very different from, I have molds in my face, for example. These are smooth and they're round and they're okay. But most people don't know that. So that's why you have to go see a dermatologist, a skin doctor, so they can actually tell you if there is a mold. And here's what you need to remember. If the mold changes color, if the mold has a, if the mold changes color or it changes its shape, if the mold actually raises from, let's say if it changes its overall, it's irregular, like there's a little point to it, those are the dangerous ones. And like I said, it's very easy to go to a doctor's office, they put a little bit of liquid nitrogen and they snap it out of there, you're perfectly fine. But if you don't take care of it, I'm sorry? Yeah? Yes, I mean, I think it can very easily be removed, that's what you're asking. Right, it can be very easily removed by either a scalpel or, yes, I'm sorry, yeah.
Yeah.
Sorry, getting a little warm in here.
3 months ago, I heard in ABC News.
Yeah.
They was talking about breast cancer.
Yeah.
They recommended now they're not going to need chemotherapy.
Right.
They're going to send it to where is the sun. They can take just the sun. The sun can take care of no more chemotherapy. I hear that one. I'd like to.
Yeah, no, I think that's a very important question. Well, first of all, thank you for the question. I want to make sure that when you guys read, be very careful what you read on the internet, because there's a lot of garbage out there. But what you're saying is true. There is a new finding that stage 1 breast cancer, these are the people that have been identified with the cancer, but there is absolutely no sign of any sort of metastasis to a lymph node. Lymph nodes are, when you get sick, your glands kind of get swollen. So if somebody is diagnosed with a stage 1 breast cancer, the consensus among oncologists now is, let's not give him chemotherapy. And here is why. This is very important. Because the chance of increasing somebody's survival, remember this, if you can actually The chance of increasing the survival for cancer patients with stage 1 is only 1 to 2%. 1 to 2% by giving them the chemotherapy. However, chemotherapy has about 10% chance of killing the patient.
Yeah, that's what it is.
So for that reason, it is of critical importance that your oncologist is up to date. And also, this is very important, I'll come to you, I promise. The biggest problem is, and I'm hoping that you can actually take this message, that if somebody's diagnosed with cancer, make sure that you go to a NCI designated cancer center. In other words, go to a person who is familiar with that type of cancer. Don't go to a community hospital and expect them to do, for example, brain tumor. I'm sorry to say this, I don't mean anything bad about the Alexandria Hospital here, but I would never go to the Alexandria Hospital if somebody has like a brain tumor or some serious type of cancer. You know, you want to go to somewhere like Hopkins, it's very close. You want to go somewhere at, depending upon what kind of cancer it is. National Cancer Institute, NIH, Sibley hospitals, those are the hospitals that they actually work on a regular basis with researchers to identify new treatments. So, exactly what you say, even in some rural area, like in West Virginia, I was giving a talk, and one oncologist asked me actually about doing radical mastectomy in this day and age. He is still practicing radical mastectomy, removes the whole entire breast on a stage 2 of cancer patient. And that's actually a crime, because no one should ever put a patient through that. 50 years ago we didn't know better, but now that we have all the resources, we should use it. But the problem is that they don't go to research centers, they don't go to meetings, they're not aware. They've been practicing the same thing for the past 20, 25 years, so they don't know any better. You had a question, I'm sorry, I know she's still...
Yes. Excuse me, sir, but I misunderstood. Are you saying blood cancer or black cancer?
I'm sorry, blood cancer.
Blood,
Yes,
okay.
yes. There is no such a thing as any kind of color cancer. Although it's important to mention that sometimes black African Americans are a little bit higher risk in certain type of cancer. For example, colon cancer, breast cancer, and prostate among African Americans, ovarian cancer, and skin cancer among the white Caucasian. So that does make a little bit of a difference.
What advances have they made in does genetics play a part in any type of cancer?
Incredible, absolutely.
The reason I ask is
Yeah.
my son-in-law, oh God bless him, he was a pediatric radiation oncologist.
Oh, yeah.
And he died of cancer at age 36.
Oh.
And they said it had a genetic component.
Absolutely.
I don't know as much about it as I should, but
No, I think this is an incredibly important question. So let me just tell you a little bit about what is the difference between genetics and what's known as so-called somatic. Your son-in-law, God bless his soul, this is obviously very sad at that early age. Sometimes people are born. People are actually born with certain, again, changes in their DNA called mutations. And these mutations are known as genetic mutations. For example, the most popular one, I'm sure everybody has heard, is the BRCA1, the Angelina Jolie, the Angelina Jolie mutation, that where she actually had the BRCA1 and she removed both of her breasts. So depending upon what kind of cancer your son-in-law passed away from, so there are now actually tests. You can do tests to find out. For example, I can give you an example of my own family. I am predisposed genetically. I have a mutation for colon cancer. So my mom passed away from colon cancer. And I know that I told my whole family member that we all have to do genetic testing, and we found out that we all have a mutation, a genetic mutation in our colon cancer disease. So if we don't take care of it, it can actually very easily kill us as well. Absolutely, very good, excellent. So it is of critical importance. If you are in your case, I'm sure either you have done it yourself. If not, you must tell your children that are over 40, they must do colonoscopy. I know that some may run away from it because, somebody's gonna touch their butt, but believe me, it's a lot better than somebody actually going there and trying to remove the colon, because it's a horrible disease. So you can actually eradicate, you can completely wipe out colon cancer. You can completely take it out if you do a simple colonoscopy. Because what they would do is, they will go inside, they look at the colon, and they identify the little polyps. If you remove the polyps, that's perfectly fine because you detected it very early. If you don't, that becomes a primary tumor, and then eventually become a metastatic tumor, and then from colon it goes to the lungs, and then it goes to the brain, and it literally kills the patient within a few years. So I would say the number one thing that you want to do is, for somebody if you have a higher risk, do it at age 40. Sometimes doctors don't want to do it, and I mean this. If they don't do it, just call me or call Erin, my wife, and I will scare the crap out of that doctor to make sure that they will do the colonoscopy for you, because it's a life-saving procedure. Because sometimes insurance here say, well, why do you want to do it because you're only 40 years old? But I can give them a lot of evidence that, look, you know what, this patient is high risk. It's better to do it now than wait until age 50. But for those of you who doesn't have anybody in the family that is genetically predisposed, that has history of the colon cancer, then start at age 50, have a baseline. If you're good, go another 5 years. If you're not good, remove the polyp, then go after 2 to 3 years. And your gastroenterologist will actually tell you that. Yes?
How long you have to do another colonoscopy? 5 years?
Yes. Right, so it depends. If they find a polyp, if the polyp is cancerous, which is again nothing to be worried about, every 5 years. But if they don't find anything, if they don't find anything, it's every 5 years. But if they find something, then every 3 years. And I know that a lot of gastroenterologists, like I said, because of the insurance issue, they try to push back against it. But I strongly encourage you, at the minimum, every 4 years. Yes. Yes. Oh, thank you. Absolutely. Yes. Okay, yeah, sure. So, shall I continue with the, Okay, so the gentleman wants me to talk a little bit more about, finish my stuff, and then we can get more questions at the end. Yeah. So I think what I wanted to just finish up with was early detection. Early detection is by far the most critically important. Now, for males in the audience, of course, there's a PSA test. Although this may not be the most accurate way of identifying prostate cancer, especially in African Americans. The incidence of prostate cancer is very high. So I strongly encourage you to go to your doctor at least every year when you get your checkup. They do the PSA. PSA is basically, you don't have to know the name, it's prostate surface antigen. It's something that can actually identify in your blood if you're either predisposed or if you're suffering from some form of prostate cancer.